Good evening, everyone. Today we have Dr. Shubham Kamle
Okay.
with us. Today we have a person who is extremely friendly, extremely good human being. Apart from being the excellent academician and apart from being the excellent physician which he is, a person whom all his patients love. Hi,
Thanks, Parth,
Shubham.
for that introduction. I'm good. Thank you for having me here in a short notice of 6 hours.
Little bit about his background. We shared some beautiful memories during our med school, but after our med school we separated, and Shubham had very varied experience. He worked in Gadchirouli, which is one of the most poorest districts in India. Then he went on to work in AIIMS, which is one of the high performing centers in India. Then he again went on to do his post graduation in Bombay Hospital, which is one of the top 10 hospitals in India. So the perspective which he can bring is one of the best, which is why I wanted to do this podcast today. Because many of us, many of you all will be confused at this point whether to choose which hospital for your residency training, in which you will spend next 3 years, right? So Shubham is someone who has taste of almost all the medical structures we have here in India, from government institutes to private institutes, from institutes like AIIMS to institutes which work in poor districts like Gadchirouli, right? And anything. So I know, Shubham, you are very multi-talented and you might have done many more things apart from this also, which I might not have mentioned. So is there anything else also, any other important aspect which I missed?
Probably I have some good friends and good family. That's all I can add. But yes, I have been. I mean, if I want to introduce myself, if you may permit.
Yeah, yeah.
So I'm Dr. Shubham Kamle. I'm currently pursuing my MD medicine at Bombay Hospital. As Parth has already said, currently I'm JR2 here, and I have completed my MBBS from AIIMS in Nagpur. And then I worked in AIIMS Nagpur for quite a time. Then after giving my PG exam, that is NEET-PG, I have joined as a medical officer in PHC Nagpur, which is one of the remote places in Gadchirouli. So ev- so that's my life. So I have been so that has been roller coaster for me. And currently I'm at Bombay Hospital. So it is one of the, yes, Parth said, one of the most renowned institute probably in India. And yes, here I'm sitting in South Bombay talking to Parth.
So Shubham, I always wonder, your personality was so multifaceted. You were always doing many things at a time, right? From being sports secretary to being good clinician, which you are. What kind of motivates you? How do you do so many things all together?
Probably the thing was I always wanted to learn new things. Um, that's not what I mean, no quote or no person has ever been that been so inspired that I just wanted to be like him or like someone to be always followed. But I think I got a good surrounding. I got some good friends, so that they helped me to grow and gather some courage to try some new things. With whom probably I have shared most of the, and all of the memories together. And really, I'm very thankful that God has gifted me such a roommate who has helped me
Oh, no,
to
no,
go
it
through
was all
all,
you.
and who has also helped me in all the who has helped me in all my up and downs. Also, I thank God for giving me some good friends and some good positive energy around me who have also motivated me.
Yeah, even I was very blessed to have friends like you. One of the things which I learned from you was how to deal with people. I didn't know how to deal with people, how to speak publicly. This is something which brushed off on me from you, and which is I'm and for which I'm very grateful to you and more. So, Shubham, you're doing your residency. I hope your residency is not killing you too much, right? How is your experience in the Bombay hospital?
Currently, I'm JR2, so it's a little chill now in here. But if you ask me about Bombay Hospital, so I mean, the time I joined Bombay Hospital, so the day one was totally, I mean, it's a new thing for me. I mean, coming from Gadchirouli to joining, I mean, doing my MBBS in AIIMS in Nagpur, the government setup, and joining in Bombay Hospital is altogether different because the atmosphere here is totally altogether different from what we see in government hospital. So what I've seen here is the way to tackle with the people, the way to deal with people as a person and a human. How I've grown over the period of time, over the period of this 1 year. I can't explain that in words because probably what I was 2 years before, it's totally a different person than what I'm today. So Bombay Hospital has helped me to grow as a person, as a human, and overall the change in personality you'll see whenever we meet
Yeah,
after
yeah,
a year probably when we'll meet.
yeah.
So the altogether different person if you see in me, that's because of the Bombay Hospital. And as a perspective to look at life, that also has been changed.
Personality wise, when I remember med school, I remember that your personality was more of a general surgeon types, but now I've seen that you have grown into this internal medicine physician, which you are. So I always wondered, why did you choose internal medicine as your subspecialty?
Medicine fascinates me. I mean, as you know, when I entered med school, it was always like I want to be a surgeon. But over the period of time, I think through internship only, medicine was a subject which brought me towards it. The patient-doctor relationship in medicine that you get, opportunity to work with the patients, direct in contact with the patients, the closeness which you have with the patients, and as a med student, you can diagnose, treat, and also prevent the diseases. Watching series like House or working in, I mean, taking the rounds which me to get in touch with more with patients and the relatives. And also, I think there's a good work-life balance in medicine if you sort the things very well. And also the respect that medicine people has over the period of time, which I have seen in Nagpur. Also, there are so many doctors, and at that time also we had so many great renowned doctors who we met during our CMEs and all. So always, over the period of time after my internship, the urge to become a physician was more than the urge to become the surgeon.
Even I feel the same way about what you were speaking. The physician-patient relationship which we can develop in medicine, I think it's equal to none other branch. And in medicine, we have...
And also,
yeah, go ahead.
And also, I had decided. I mean, when I was studying for NEET-PG, I have that quote in my mind: PG or BV. सोच समझ के चूज करना और जिंदगी में एक ही बार करना. So before choosing medicine, I thought a lot. It was a big discussion. Even I could have got a government college for my PG if I would have choose surgery, but I was so sure about medicine that yes, that's why I'm here.
Speaking of government and private, medicine basically has two parts, right? One is the sophisticated part of medicine, and one is the hands-on part of medicine. Sophisticated part of medicine, by which I mean like diagnosing a patient, making differential diagnosis, ordering tests, and thinking that what's the most probable diagnosis which can explain everything, which is like 70% of the medicine, and 30% is hands-on, like intubating, paracentesis, thoracocentesis, other hands-on skills which we require. So how was your experience regarding these areas in your residency at Bombay Hospital?
Of course, there's a huge, if you consider the government hospital, there is a huge disparity, because at government hospital, the flow of patient is so high that the amount of patient will get to do procedures will be always on the higher side. But at Bombay Hospital also, it's not, today I have intubated a patient, I have put a C line, I have put a line, and after that I'm coming here for this interview or podcast. So it's not in the way that we don't get to learn procedures. It's not in that way that you don't get to learn new things, or probably the amount of procedures we do at government hospital is far less in private hospital. But you learn how to do it in a proper way, in a proper manner. You get to learn how to do in a proper procedural manner. You take your time and you do in proper aseptic conditions. Probably that thing in government hospital also we do that, but definitely we are more.
Yeah.
We take all the precautions here, and the complication related, that's why, is very minimal. I've seen rarely any complication happening because of the iatrogenic causes. And yes, the protocols are followed very nicely, and hands-on part is good. Apart from that,
the sophistication of medicine.
Yeah, this is what I have come across most, because at Bombay Hospital, all the patients in our unit, we have nearly 30 to 40 patients now. Every patient, what we go for is diagnosis. The patient gets admitted within 24 hours. We try to go for the diagnosis, whatever critical condition patient is, or whatever complaint patient has come for, and that what helps. That what helps for over a longer period of time. Rarely happens that we miss a diagnosis, because extensively we take help. That is how holistic approach helps. In the corporate hospital, this holistic approach is very advantageous. As we go, if there's a nephro patient, if we find there's something which has to be taken help from the nephrologist, we take the help. If there's some cardiac cause, we help the cardiologist help. So the diagnosis, treatment, management, everything is nicely followed. So of course the amount of flow will be low, but how to manage a patient is always I can say it's good. Every doctor wants his patient to go home happily. So,
yeah,
but
actually,
at my workplace, I can say with that. we try to cure the patient. I mean, that's it. We go for the diagnosis. We try to cure the patient, and of course, the hands-on whenever necessary. There's a good hands-on, and we try to manage.
Yeah, the point I was trying to make was what are your goals from your residency? The important thing is what are your goals from your residency, and you should match that with the type of hospital you are going to. So if your goals is becoming house MD, so Bombay Hospital and Tata Hospital might be better to train you in that kind of a way. But if your goal is to become more skilled in hands-on skill, then I think government hospitals are better. It's just that what do you want in your life, right? And how was your experience in Gadchirouli, and how was it different from what you did in AIIMS? If you can shed light on that.
There is a huge difference, I can say. In AIIMS, after our med school, it always I wanted to grow. I mean, that was everyone wants the same. I mean, all our group people, we also wanted to go ahead, go forward. So that's why, I joined AIIMS. So at that time, it was a COVID time, and basically it was from the intern to directly managing the ICU. It was a total, different experience. The amount of patients that were there, we have to manage a ventilator within 2 months. We have to learn all the ventilator settings. We were doing tests like procalcitonin, which are not heard in AIIMS actually. But for the period of Corona, we have come across. In AIIMS, the atmosphere was also very cool. I mean, you have time to play basketball. We have to play time to table tennis. You have time to go for gym. You have time for yourself. You have time to go to Nagpur city, you roam and come back. You have leisure of life. So that was what a modern city and modern medicine, which we have practiced in AIIMS. That was a different experience. But after my exam, I thought just let's spend some time in the places where there is no medical facility. That's what I planned to join PHC in Nagpur. So that experience was totally thrilling. Totally thrilling. I was the most literate person in that whole village, not in that village, in the vicinity of 50 kilometers probably. So the respect you get in that area, the amount of life you can affect in that area, that is not, you can't describe in words. Small incidences for little, if you want to take suture also, they have to go to 50 kilometers away. But when I came, I used to do small procedures in the same PHC. When I joined that PHC, the patient flow was 10 patients per day. 10 patients per day because there were nothing. There was just sister and some other staff, pharmacists who were there in the PHC. But after the span of 3 months when I left, there were 60. The OPD has gone up to 60 patients per day. And of course, from pediatric patient to all the medicine patients, whoever the diagnosis help. Dermat patient, all the patients used to come to you, and I have made a big PDF of 50 to 60 pages where I have found the diagnosis along with the treatment which I have given. So that experience helped me. People used to call me at their home as a chief guest. I have gone to the satsang and bhajans which I never have joined. I clapped. That bhajan kirtan, I have done all that. They used to call me for food. If they make some good food or some non-veg from there, they used to call me, and as chief guest, I used to go. It was a very thrilling experience. But the perspective is, even when in my free time, when I used to roam in that place where there was nothing, I clicked some photos and put in my Instagram. The vision, it's not always that. It's so beautiful. The nature is so blessed. It was a wonderful experience working there. So that I don't regret that 3 months, but I have learned many things to deal with. So I think everyone should try to serve at some PHC or rural areas at least once in life, because that experience helps you a lot. That brings you more. That brings your connection to the people. Again, the more what I can say that wants people, I guess, and that's probably the most important time when I realized is medicine, because every patient they are used to come. Even the hernia patient used to come and ask, "Sorry, दवाई से कुछ हो सकता है क्या?"
I'm wondering, in today's time, when we hear so much about conflicts between doctors and patients and violence against doctor, what did you do that helped you to have such a beautiful relationship with your patients?
This has, how to explain this? Because in the last 2 years, there were really some incidents where I have some conflict with the patient, but most of the time, I think it's because lack of knowledge which patient and the relative has that causes this. If I have to give you some example, there was a patient with hyponatremia who was admitted to us. So his sodium level was 105, he was admitted in ICU. So the relative came and they created huge nuisance at us, and I was the GR1 at that time. So she came to me. The admitted patient was her brother. So she was like, "एक दिन हो गया, अभी भी sodium बढ़ा नहीं है. What you are doing with my brother? Why so?" So I described her. See, we have to correct sodium slowly. It's not that we have to. I explained her. I sat down. I made her sit, calmed her down, and told her that we have to correct sodium slowly. We are correcting it by the protocols. We are going slowly, and probably you give us some time, and he will recover. Probably the next day, the sodium was corrected for 105 to 113. That is the protocol. You have to correct it 10 milliequivalents per day. And then slowly after, when the sodium level was more than 120, the patient was neurologically better. And at that time, the sister of the patient, she came and she said sorry to me. And I didn't expect that, but probably she had Googled it somewhere and then this is what the protocol is. So what mostly happens is patients are very anxious about the relative. So the relatives are very anxious about the patient, and the lack of their knowledge and the perspective which people has created about the doctors, that we are here to earn money. So this in the back of the mind which patient has. So probably this causes more conflict between the doctor and patient. And of course there are multiple factors. Probably somewhere doctors go wrong. So probably somewhere the patient's relatives are go wrong. Probably they come with the mentality of mob only. So these are the other aspects. But if the most, as my guide says, वो patient सबसे जल्दी ठीक होता है जिसके relative भी शांत रहते हैं. So I also think that patients should also be as composed, and the relatives should also be as composed as the doctor should be. And this relationship helps for all the aspects, even for the betterment of the patient, even for the healthy relationship between the doctor and patient, and for the mental health of all the well-being again.
I mean, what you're saying is more often than not, it is the miscommunication between the patient and the doctor.
Yes, sometimes in the government setup, if you'll see what happens when we are in the government setup, same, because the patient relative were like, हम इलाज ही नहीं हो रहा है, कुछ भी नहीं हो रहा है. The reach is not, whatever the treatment is, it is not reaching up to the patient relative, or probably they don't know what we are treating. Probably sometimes the IV fluid is the only treatment of choice. Given a scenario, there was a patient of dengue admitted to us, related to 30,000, and the relative were like, तुम तो बस fluid दे दो, इससे क्या होगा? They knew it was fluid, but that's what we treat. So yeah. So that's why we have to calm down the patient. We have to tell them that this is the treatment. This is how we treat dengue. And over the period of day or two, when patient is recovered, then they become happy. But this goes the other way. If patient deteriorates in that period of time, when the platelet were low, and patient had to find out that only the fluid is ongoing, so they will take it another way. They will create this. They will take this topic as an issue. So the communication gap, I think it should be bridged. The more you communicate, the less the chances of clashes between the doctor and patient relative, I guess.
Do you think in our medical school curriculum, the communication part is not taught well enough during our 5.5 years?
Yes, definitely. Even our UG life, there was no such class. Do you remember anything like that? What I've learned here is the same thing. As a doctor and as a person, you become, that's the advantage I can add on to you in the private setup. That you don't grow only as a doctor, as a person also. As a clinician, you grow up. So the communication gap you have to bridge always. It is very important to discuss whatever we are treating, whatever our plan is, and whatever the diagnosis is. Everything should be clear with the patient and relative. So that helps. That really helps.
What are some other pros and cons also, which you might tell our viewers about doing your residency at Bombay Hospital or any high performance institute in India?
If you want to enumerate it, I can say infrastructure, whether it is mechanical, if it is manpower, if it is machinery, and about the hygiene. And the second thing, you can see the exposure to complex cases. Most of the cases which will come to Bombay Hospital are the complex cases which are probably not diagnosed somewhere else, and they come in here. And the other thing you build up is, as you talk now, reputation of a doctor and about networking. You grow, exactly. You can have a good reputation, and the networking always helps. The third thing, as I always say, as a person you evolve, as a doctor you evolve, and as a whole you evolve in a private setup. So that are the basic three things. And of course, to go for the cons, there is always a high expectation from the patient. Patient will always expect कितने बड़े hospital में आए तो हम बचने वाले. But we have to,
Yeah.
I mean, we are not God. And then there is some VIP syndrome, which we say in Bombay Hospital. It is not VIP POMA, it is the VIP syndrome, the very important person syndrome. So you just Google it, I hope you will find it. And then there is always a risk of burnout. Sometimes you have to talk more with the relatives and work less, and sometimes you have to work so much that you get time to talk less or sleep less. But yes, these are the some pros and cons that you have to always keep in mind.
When you look back at your experience in AIIMS and IGGMC, what do you think their pros and cons might be?
So if you'll ask me about the comparison between the other setup where I worked and at the Bombay Hospital, so see, there sometimes we have, as you also know, we have sometimes struggled for gloves, we have struggled for masks, and we have struggled for the ECGs at the casualty. This is what we both have faced. Okay, and limited resources, limited antibiotic. We know the setup antibiotic were there. The limited resources were always there. And when a patient comes with MI, we have given streptokinase. There are no modern pharmacological methods which we use in other setups. So, but at Bombay Hospital, I have seen over the period of time, patient with other illness can be managed. I'm not saying they can go home, but can be managed nicely. Even in stroke, I'm particularly mentioning stroke because at my place, I have seen the patient with stroke were used to die with some respiratory infection or some other type, who are hemiplegic or hemiparesis. But here I have seen patient can be managed over a period of time, can be tracked down, can be with good physio, good health, and everything can be managed and can be sent home. That was one of the first impressions which I had here at Bombay Hospital.
Lack of resources brings a lot of side effects with it. But one thing which is good, which comes with lack of resources, is like you remember, we didn't have echo. So every time we had to listen to the murmurs using our stethoscope.
Right. Clinically, they are more advanced clinically, right?
Yeah, so clinical skill wise, it can help.
The exposure of the OPD that government people get, about 100 to 150 patients they see every day.
Yeah,
that will lack. I mean, at any private hospital, you won't see such a huge flow of patients. Probably there are some hospitals, and DNB hospitals and at the Bombay hospitals, the flow of OPD patients is low. And even if you comparing the IPD and OPD, the protocols are mostly the same. If the protocols are followed, then okay, the patient can be managed very well. But the OPD exposure and the prima facie looking at the patient and diagnosing the patient clinically, it's always will be good at government hospital. Then second thing, the other thing if you can add is the hands-on they get because of the patient, the experience they get, and the amount of competence that or probably this thing generate it will be always on the higher side. Plus, you can add on this and about the academics you can say because they are main JRs. I mean, they are residents. Nearly 10 to 15 in KM, they are 30 to 40. So the number of residents are more. So the academic activities are more. So which will definitely help. The competitive nature will always help. But definitely we get some time. If you want to go, you can go from anywhere. That is the code. But
the combination which you have the experience of low resource environment as well for 5.5 years, and then in your residency you have the experience of working in a good resource institutes as well. So I think it can help you balance out and have the best of both the worlds.
Yes. I'll definitely say. I always suggest everybody to work at a government hospital for some time, at a PHC sometime, and also at a corporate. And then one big institute at a given period of time. Everyone before starting their practice, they should always do this. I know I'm a very small person to say this, but I will definitely recommend my any colleague who's trying to set up the private clinic. I'll always guide him to at least work at a government setup, work at a private setup, and work at some remote place for a short duration. It will always add on to their experience, add on to the way to deal with patient, and also for the diagnosis. It helps definitely.
And it will also help you make connections with physicians who are like 10-20 years ahead in the curve, and you don't have to go through that journey. You can just learn through them, right? Have good mentors.
Their experience matters a lot. Even if you ask me, yesterday there was a conference of DPL, diabetic conference. So the editors of Harrison were there. I mean, and they just passed by. Pratik and me, we both went there. So we were just discussing the thing. And even with their experiences, we learn a lot. At Bombay or the major cities, the advantage is that you can learn from the experience of your seniors.
Sorry for the interruption, people. I guess what we were discussing before this was whenever we go to join a program for residency, a place where we will stay for next 3 years, we have certain goals and expectations in our mind, right? So what were your goals for residency before joining Bombay Hospital, and were those expectations met during your time in residency at Bombay Hospital?
The day I joined Bombay Hospital, I made it myself clear that I have to do my best. That was the thing which I promised myself. So over the period of time, of course, there was some clear picture in my mind that I have to be a good clinician, I have to gain some knowledge, and I have to be good in academic research. And third is, of course, about the procedures. So starting with the clinician, that was the first year I put it in the way that I should always go and see myself for the patient, try to auscultate, try to see the clinical signs and all. I hope in the first year I used to sleep for 3 to 4 hours. That habit is inculcated in me now also. Today also I sleep not more than 4 hours, and it's a habit now. The goal probably met or not over the period of time I will come to know, but I tried my best. Second, it was about the academic part is left behind because as I said, there are only 1 year in one unit and we have 5 consultants. So the first year goes a little hectic, and in second year now this year I have reserved myself for myself and for the academic purpose. So the secondary goal was for paper presentation, poster presentation, and some academic work. So I have now lined up 3 of my papers. One is on hypokalemic theoretic paralysis, second is on cardiac sarcoidosis, and the third one planning in hypertensive studies. So probably in next 2 to 3 months, I should fulfill. And I'm planning to conduct a seminar with my guide, Dr. Suraj, which will be on thrombocytopenia evaluation of infectious disease along with some other causes, hematological, probably related to CLD. So that is the conference which I'm planning to conduct. And the other things, if you'll ask me, yes, MRCP is lined up, planning to give MRCP if the time permits, and if I get some, definitely I will study for that.
First of all, congratulations for the 3 submissions. Having 3 submissions in 1 year is really
I have not submitted yet. But I have documents. So that's what I told you. In the next 3 months, mostly I should be doing this. My targets.
All the best for your submission. Yep. And I feel the research was something which was lacking from my CV as well. We usually didn't have that much of a research exposure. How is the research experience at your residency hospital? Do they support it, or do you have to work beyond your normal hours and dedicate extra time towards research, or do the hospital gives protected time for research activities in which you are free from your clinical duties?
Actually, there's ample amount of time to study. There is no limitation from the hospital that you don't have to do, or you have to. There's no restrictions. But the problem, and if you ask me if they're supporting, they will always help you to take out the documents, whether it's financial or even as I said, I want to create a CME, they will help me with the auditorium. Everything will be sponsored. So the only thing that we lack is the insight and the sometimes the lack of time. That's the only thing. And also the manpower, because being only 2 residents in each year, so total of 6 residents, 2 of the times are ongoing, exam going. 2 of my juniors always working. So second is the only time when we get some ample amount of time. So whatever academic work or research we have to do it is in the second and third year. So that's what is lacking is, you should be strong enough, and you should have your own time, and you should have your own research work which you can go forward with it. So
yeah. So we have basically discussed everything good about you, right? But we have to give a human touch to you as well. So I'll ask you one question, and you can not answer that also. Do you have any failure in life, or any moment of personal introspection?
Failure is a part of that. There's no life without failure. But if I go back and see, that has made me what I am today, and I won't regret. I won't regret what I am today. So over the period of time, my failures and all the things which I've gone through, probably that has helped me to become a person what I am today. So there's no regret as such. But yes, I have probably at some time I feel that I have not given ample amount of time to my family, to my friends, due to the med school also, the hectic schedule studied in the med school. From last 2 years, I just went for 1 to 2 times in my family get together or something. That is the only thing I like. But as Vedamani says, अगर बिरयानी अच्छी हो तो रेसिपी क्यों चेंज करना? So we'll keep the recipe same. I won't regret what happened in the past, and I'm happy with what I'm today. And I'm trying to learn whatever mistakes I made. I'll just try to learn. I mean, to correct my mistakes and probably go forward with it. My initial days of my life, when 11th, 12th, when I was a totally different person, when I used to roam in the city with my bike and the type of company which I had, and the drastically the change of my life from that situation, that was something to learn about. I didn't do any mistake, but I thought that the waste of time or waste of that year was something which I would have avoided if I would have been in a better company, or probably my mindset would have been in a better place. So probably I would have been here for a year before or two.
When I remember our first year, I remember that we used to study in the library for like 3 a.m. and 4 a.m.
Who
3 at
studies
night.
who studies at night? Who studies at night in the library? Who wastes time throughout the day and just sits in the library at night with the regret.
So I guess that was both of us at that time.
Right.
So do you have any role model whom you try to emulate?
You will say, in our room, you have seen the photos of Bhagat Singh and Baba Saheb Ambedkar always. Before the Aam Aadmi Party, I launched it probably. So talking about role model, I always try to keep my role model close to me. The role model can be you. Of course, I have learned many things from you.
Oh, arey bhai,
Anybody. Even today, if you ask me, that's true. Even today, if I ask me a role model, I will just say my guide. Even my guide. If you'll see Dr. Suraj Jain sir, Dr. Praveen Amin sir, they're like 24 hours dedicated to the patient. Suraj Jain sir comes at 2 a.m. whenever he thinks he should see the patient. Whenever we call him, just pick up the call. The way he talks, never seen him getting angry. The way he behaves, the way he carries himself, the attitude he carries himself. Even Dr. Praveen Amin sir, the way he deals with critical care patients, the dedication he has, the sheer dedication. You can call him at night whenever, and the opinion and whatever the lifestyle they follow, a good healthy lifestyle, their personal life and private life. These are the role model. Even Dr. Nagesh Vagmare sir, who is a good known cardiologist in Bombay, his journey from Nagpur to here. These are the people who are role model to us. You don't need to go somewhere and see for the role models. If you keep them in vicinity, every time I see them, I feel motivated. And whenever I waste my time and come back, and when I see them, you again get motivated. So I always prefer keeping my role models in my vicinity, and hopefully God has always given me my role models who are always beside me. And for me, the definition of role model is who helps you to become good as a professional person and as a personal person in a professional life and private life, who makes you a better person, who motivates you to be a better person. So if they are in my vicinity, why should I go somewhere else?
Yeah, exactly. So I read this quote somewhere, I don't remember where. Knowledge is the breeding ground of arrogance. And one profession in which people study the most is that of physicians and doctors. Sometimes I feel that arrogance also tend to creep in. Do you feel that it happens to you as well? And if yes, how do you deal with it?
I won't say it's arrogance always, because I haven't seen my concern to be arrogant with the patient for no reason. Always they will try to be calm and composed, but the only arrogance you can compare will be the aggressiveness to treat the patient. The only thing that matters is probably there are doctors who are more arrogant. We have heard of them, we have seen them, but definitely I have seen very minimal of the doctors in here who are arrogant in their attitude for the patient, because probably in the initial part of life as a resident, even when I joined, I was a little arrogant. That is not taught to us. Probably the values which were probably not added to the curriculum, probably how to talk with the people, how to deal with the people. So that arrogance was an initial period, but over the period of time, as you grow as a doctor, as a physician, you realize that it's not an arrogance. That never helps.
You were one of the most humble persons.
Sometimes failure makes you humble.
Learn from you next time I meet you. When are you coming to Nagpur? Yes, you are in one of the most fine centers in India. How do you see internal medicine progressing in the future? What changes are you anticipating in our field in next 10 to 20 years?
Internal medicine will always be internal medicine. If you ask me, what I told you, I will always prefer internal medicine than super specialization, because the holistic approach medicine gives you nothing. Even if you ask my super specialty seniors who have joined here as resident now, they always say internal medicine is internal medicine, because the way you can deal with patient, you can manage diabetes, you can manage heart failure, everything. You can be a complete house MD. So that is altogether different thing. And uh, of course, genomics, the new technology, everything will come and go. But clinician will always be clinician. Physicians will always be physicians. Medicine will be one of the top branch. Whatever happens, wherever the world goes, the first point of contact will always be a good physician. And if you're a very good physician, probably your diagnosis will always help the patient. Your treatment will always help the patient, and of course, the blessings will always help you in your life. AI is one of the AI is the future. You have to accept it. There is no doubt in that. And even a recent seminar which I attended, you won't believe, but the South Korean has done a brilliant job in this. They have the equipments which gives lab report within a second, within a minute. Yesterday, I have checked my HbA1c within 1 minute. Thyroid properly 1 minute. These are the modern technologies which you have to inculcate. And Bombay Hospital have always been tied up with AI institute in India, which are working in medical field. So last 6 months only we have some integrated program with Bombay Hospital, and I don't remember the name of that society.
Sure.
But of course, we are trying to take AI with them because that's what the future is. Even Expirience has the open MRI now. The claustrophobia is gone. So
really?
Yes. So the modern technologies are brilliant. You can't. They are doing wonders.
That says a lot about Bombay Hospital. Shubham, for any student who is looking at Bombay Hospital as a potential place for residency training for next 3 years, is there anything else which you'd like to share with him or her, or like to let him know, or wanted that you knew that when you were coming here?
Of course, I've been receiving many calls for as people are planning to join Bombay Hospital. For them, just I'll brief what are the pros and cons in Bombay Hospital. So, particularly in medicine unit, there are 2 units. Each unit has 5 to 6 consultants, and there are 2 JRs each year. So there will be one JR1 for each unit. So you have to consider that you will be only one person looking at the patient of the 5 consultants. So hands-on are good at Bombay Hospital. There are good guides, and teachers will be always there for supporting you. Healthy working atmosphere, no toxicity at all, no ragging. Hostel facility is available, no hidden charges in here. They don't charge you anything else other than the fees. Payment is on time. 3 तारीख को पैसा आ जाएगा. Highest paid hospital in Maharashtra, 90K salary. Management also supports the students and the residents. And if you ask me the cons, then OPD experience is poor. Of course, you have to accept it. There's no OPD exposure. In the first year, it goes hectic. So if you are planning for work-life balance, then it will be difficult because you will have to work 365 days. And of course, dealing with the VIP patient will sometimes can kill your mental. You have to get with it. And there will be definitely, you can't compare the hands-on with the other government hospital, but definitely you will learn. At the end of the day, you will learn what need to be done, what makes you a good clinician, and what makes you a good physician. So, and the academic part, of course, as in government hospital, there are many JRs, so the academic part is good. They have good PG activity, everything. But as we have less resident, so the academic part sometimes lags behind. But it depends on you. There is no limitation for anybody to not to do any academic activities. The management and the guides will definitely always support.
So you also mentioned that there are many VIPs who get treatment in your hospital. I was wondering, do you guys also get to interact with them and see how the treatment goes about, or is it totally covered by the attending physicians which you might have under whom you are working?
No. We totally attend the patient. You won't believe, but there is a good hands-on and good coordination between our consultant and us, and with the patient. I have been personally in contact with so many politicians that primarily try to contact me rather than going to the consultant, because they think rather than disturbing, they have developed the faith in me. Even my consultant, they have developed that faith in me so that I can deal with the patient. Multiple IS officers, IFS officers, along with the politicians, Bollywood celebrities, I have been part of the treatment. So it's always a collective decision about the treatment. And so yes, it's not like you don't have to go and meet them. Of course, for the treatment point of view, definitely, whatever for the benefit of the patient, it's always been done. And yes, definitely, we look at the patient on prima basis, and then we inform the consultant, and then finally, whatever the treatment is, whatever necessary things to do, we do.
Thank you so much, Shubham. You have given a very good overview of what working in Bombay Hospital looks like, and I think it will definitely help the upcoming students in deciding on which hospital to choose. Apart from that, how are you? How are you, Shubham? How are you doing?
I'm good. Keeping up my health. BMI of 24.3, body fat percent of 14%. I've done some cares now with the PRP, some money in stock markets, and burned up all the fat. So I can say I'm pink of my health and wealth. Probably I will start studying and I can add on to that and think of my health, wealth, and knowledge.
I've also seen some of your pictures recently, and you look very shredded. And why weren't you like this in our college days, Shubham?
That is the biggest regret I have. If you ask me when I look back at what I would change, I would change that. Probably I would have went to gym. I would have focused more on my health at that time. I would have been in better position than what I am today. But of course, they were those time. And of course, I'm trying to dance. I have joined a Garba class twice a week. So trying to learn some moves. South Bombay is mostly dominated by Gujarati. So I'm trying to learn their language. Like, the only
Nice
thing
move.
that a man can evolve, I think that's language. My concern is no 5 languages. So my aim is to know at least 4 languages, which probably I'm trying to learn Gujarati now. And let's hope with the dance and all form, probably it would help me to learn more of Gujarati culture and Gujarati language.
So you're internal medicine doctor. You are in good shape. You make ample amount of wealth. You know how to dance. You know 3 or 4 languages. What are you trying to do? Are you trying to become James Bond? Huh?
I'm trying to be a good human, good person, and a good doctor. The first impression of the patient on a doctor is also very important. So I don't want to look like a person whom they will not admire. So I've cut down everything. I'm trying to eat healthy, drink healthy, live a healthy life, take some time for my workout, and I'm talking to my family daily. I've started a recent new hobby, you can say, to listen to podcasts. Daily I listen to one podcast, and I try
Which
to
person do you
learn more
listen to?
things. Anybody, Abdalia, Ramani, even Varipu, even Sandeep Maheshwari. So whoever I feel can inspire me or motivate me, even a short podcast, they help. They really help.
How is living in the Bombay?
बॉम्बे नशा है. एक तो डूब सकते हो, नहीं तो निकल सकते हो. So if you'll ask me, it's totally a different city. If you've seen dates, more of hectic people running here and there. Bombay changes every 100 meter. The quality and quantity of people you'll see in Bombay is unmatchable, unbelievable. The energy that people put into it is unbelievable. So of course the public transport I enjoyed, the local train, taxi, everything. मुंबई में वक्त यानी पैसा पैसे से ज्यादा अहमियत यहाँ लोग वक्त को देते हैं, वो भी अच्छी चीज है. और एंड डेफिनेटली द सॉन्ग वी हैव हर्ड, शोला है यहाँ बिजोरिया, दिल की बजरिया, बॉम्बे नगरिया. So that holds true. Bombay is Bombay.
Do you plan to stay in Bombay and settle here, or do you plan to go back to your home city?
I don't know really. I mean,
I
if
mean,
everything goes well,
the way you are
if
speaking
everything
about
goes well,
Bombay, it looks like you're planning to get settled in
तो वही अगर मोहब्बत हो गई तो रुकना पड़ेगा. You can't leave it. So I'm trying to not to fall in love with Bombay.
No, but you can.
क्योंकि
If you like her so much, you can, right?
yes, I have one more year to explore. I mean, I'm trying. I'm trying to know what I have to do. I'm trying to sort out what I want to do next, because see, because MD medicine or super specialty still it's a dilemma for me now. So probably in a year or so everything will be sorted, and probably I would answer you your question in the same time next year in a more appropriate way.
I hope you're successful in all your future endeavors, Shubham. And thank you so much for being here, for taking out the time. I know it must have been a very long day for you, and you must have been very busy.
Thank you, Pat. Thank you. It's been a pleasure for me to be talking to you, and I hope we'll meet soon. And all our friends, we need to get together soon.